Hello, everybody. Welcome. I'm Lisa White. Got Dr.
And
Greene.
Robert Greene.
And today, for our clinical conversations, we're going to kind of change today's topic, in celebration of National Infertility Awareness Week, which is we're wearing our orange. Dr. Greene's got his orange on. And
I even have props today.
I love it. And so we thought we'd kind of share a little bit more about our stories. And one thing I've always, admired about you, Dr. Greene, like you are not only an amazing fertility doctor, you have personally gone through this journey that so many are struggling through. And I kind of wanted to let you share a bit of your story. And before we get to that, though, maybe kind of give us an update because we're still being quarantined and social distancing. That's why we're doing these virtual calls. What updates can you share with your clinic here in Denver? How are you guys doing and when you might resume treatments?
Yeah, we are in the process of actually resuming treatments. And then the point is that we do things in a very planned fashion, taking into account that the weeks and in some situations, months leading up to any treatment really do impact the outcome based on their effects on egg quality and sperm quality. So we are in the process of ramping up. It's kind of interesting in the way we do things. It's not like flipping a switch on or flipping it off. And so that dimmer switch is getting brighter and brighter every day. And we've got people that are in the works to be doing a full treatment within the next several weeks.
That's awesome. And do you have any kind of priorities as far as, is it those who were close to transfers or egg retrievals or?
Well, to be honest with you, things have gone very well here in Colorado. Governor Polis has lifted the mandates. The hospitals where I operate at have asked me to resume elective surgeries because their resources are not being overstretched. That being said, we are asking all of our patients to still maintain very cautious, safe distancing and social distancing. Mm-hmm. Because part of how we're doing this safely, we're limiting the number of people that we allow to enter and leave our facility. We don't want to have people that have any, early symptoms or recent exposures to expose other patients or the staff.
Right.
So we are asking people to keep monitoring and being very careful with social distancing, because if any of our patients that are going through treatment become symptomatic or have a recent exposure, we will feel compelled to cancel their cycle. Okay. So, we're basically opening up treatment to everyone that's willing to maintain certain degrees of caution and respect for, what's being asked of all of us right now.
Yeah, thank you for sharing that update. So, where do we even begin? I mean, tell me how old your daughter is now.
I still refer to her as the embryo. My embryo is 12 and a half years old, so she's a full teenager at this age.
A teenager. No, I love that you call her your embryo. And my husband nicknamed our daughter, before we knew we were having a daughter, a Dot, and I'm wearing our shirt, Dreams to Dots. It was the shirt that we wore for the fertility walk last year, and just a little, just a little dot. So she's 2.5 now. But tell me, would you mind sharing a bit of your story?
Yeah, it's interesting. I don't believe that going through fertility treatment changed the way I do things, but it definitely made it more personal, because despite all of the knowledge that I had over the years, my journey, just like everyone's journey, had its unique challenges. At the time I was in a solo practice where I was the only fertility provider. It was up in Northern California. There's Mount Shasta, a photograph I take with me. And I've always hung in my office since I've left Northern California. And my wife was actually working within the practice at the time. Because we decided to go through this process ourselves, we felt a certain degree of social isolation, which is very poignant to this discussion today. I know many fertility patients have gone through that, where they don't know what they should or feel comfortable sharing. We didn't feel comfortable sharing because my wife and I were both well informed enough to know that we might not be successful. And we didn't want to deal with the pressure and disappointment of our staff or
Mhm.
my patients. And so we basically, had to do things, on a very unusual basis. We weren't talking about it with family or friends. We weren't
Mhm.
talking about it with the staff.
Mhm. And were you like when my husband and I went through it, I was 38, my husband was in his mid 40s. What can I ask around what age you were when you were going through this?
Yeah, my my wife and I, we were both very much on professional career tracks and
Yeah.
kind of enjoying some of the crazier activities. She was into bungee jumping. I was still doing some hang gliding at the time, and
Oh my
we
gosh.
both loved scuba diving. So, and kind of crazy mountain biking as well. So we didn't really plan on having kids until fairly late in the game. And,
Later.
my wife had basically approached and passed her 40th birthday when we said, you know what? She said, maybe we'll have a child. I'm
Yeah,
kind of interested. And I said, well, if you're in, I'm in. But,
I love
we
it.
both knew that based on our age, if it was going to happen, we, figured we'd jump in. And
You chose
so
this,
we figured a little bit of assistance would be necessary.
and you chose your specialty then way before deciding you were going to have kids.
Oh, absolutely. Yeah.
Yeah.
I mean,
Yeah, that's
yeah.
interesting.
Yeah, I mean, I truly went into this field because I found it fascinating and, just a wonderful mix of both science and emotion and
Mhm.
emerging technology. And it wasn't based on any personal journey
Right.
that I ever thought I'd ever be undertaking.
Yeah, no, thank you. That's a really interesting thought to think about because you were just committed to helping individuals and couples through this process, and here you go down the road yourself. Did you,
Yeah.
if you feel comfortable sharing, was it IUI, IVF? Did you have multiple
Oh,
rounds or?
again, one of the things that's important to keep in mind, this field is continually evolving.
Mm-hmm.
Success rates at the time we first started were nowhere near what they are today. And
Mm,
again, I know success rates vary tremendously from center to center, but
right.
even national success rates, as well as the best, fertility clinics at the time, were somewhat marginal, and the difference in success rates between IUI and IVF weren't as dramatic as they are today. So of course we started with the simpler,
Right. Okay.
more basic procedures
Right.
and
Right.
and hoped for the best. And we, like most couples, we had some bumps and bruises along the way. We had some early success that resulted in a miscarriage, and again, we were still not disclosing anything to anybody. So
Mm-hmm.
we experienced the joy and then suffered the disappointment, just the two of us. But yeah, ultimately we weren't successful, so we had to ramp things up to going into more of the technology and doing in vitro fertilization. And at the time I was working with a group I was affiliated with because we had shut down the small IVF program we'd had in the far northern regions of California because, to be honest with you, the technology was developing faster than my financial resources were to keep up.
Oh, wow.
And, knowing what was available and knowing what I couldn't offer, in my own, center was challenging for me. And so I realized I had a battle with my own conscience, and I realized best thing to do, and this was even before my wife and I were involved as patients, best thing to do if I couldn't offer the latest technology was to not offer it locally. And I started outsourcing a lot of our fertility treatments to a group I was working with in the San Francisco Bay Area.
Mm,
And again, we'd gone through those changes before we got to that level of our own treatment. But so when I decided that it was time, and my wife and I agreed to move forward with an IVF procedure, we were actually doing it at the center that I was affiliated with, which took some of the local pressure off because we lived about 2.5 hours away, which created a certain degree of commuting that was required. And
Yeah.
like I said, we had our own challenges that aren't that different to what a lot of my patients today are dealing with.
And just having experienced a miscarriage, I'm sure you just have so much more empathy for your patients that have experienced that. That's a unique.
Yeah, I always tell people all the time, the only, when I'm talking to anyone, whether it's an individual or a couple, I'm always talking about live births because, pregnancy rates are meaningless. There's no half points in what we do. It doesn't help anybody to say, well, we were almost successful. So, I'm always focusing on live births. And, when I'm talking to anybody, I always want to know how many children do they want to have? Because, not every pregnancy succeeds.
Were you successful in your first round of IVF?
No, we were not. And in fact, again, this is further informing probably. Part of the reason I decided to make some big career changes and break my affiliation with the group I was working with, to be honest with you, Lisa, I didn't like the way I was being treated as a patient.
Wow.
My wife and I were both extremely well informed on IVF, and at the time, the people we were working with were really pushing us to put in more embryos than I felt comfortable doing, because I knew I didn't want to raise that many. and to be honest with you, it literally got to a point where, I very politely said, no offense, I'm as smart as you are, and I would rather risk failure than risk, an unhealthy pregnancy for my wife or my future family. And this was, again, back in the era before as many centers were doing elective single embryo transfer, which is something me and my partners very, very vocally support.
Yes.
In fact, almost 90% of our patients get one embryo, and the remaining get two, but we don't ever do more than that at our center because, again, we're focusing on healthy live births.
Yeah, I was going to say, to share the science behind that, I know that was advised for us. We only had one embryo, of course, but you really all advised on this. The statistics are better for just transferring one embryo versus two.
Yeah, in the vast majority of situations, that's the best way to go. It's the safest way to go. And so, at the time, I decided to make a big career change, and I politely severed my relationship with the people I was working with, and basically ended up closing my Northern California practice and joined a group out of Sacramento at the time that was doing some of the leading.
You moved around a little bit.
Oh yeah, well, that's one of the interesting things that I've always learned, and maybe I'd never really reflected on it, but part of what I decided at that stage of my career is that I want to be amongst the best. I don't want to settle for this is as good as it's going to get here. I want to be the best.
Yeah.
And so I started a journey of looking for, better and better options. And ultimately it wound me up where I'm at here.
Well, so many of my friends who've had you as doctors think you're the best. So I'm going to keep
that's too kind. But I still look at how much better we can be. It's like one of the things that I was trained with is if you think you're at the top of your game, it only means everyone else is gaining on you. So.
Keep climbing, right? So how many, did you go through multiple rounds of IVF?
No, again, this is another interesting part of the story. It was during this transition, none of these things happens very quickly. So it was during this career transition that, my wife and I agreed to basically try a couple of more IUI cycles until things got more settled. And basically that's when we achieved our success.
Oh, wow. Okay. Wow. That's wonderful. Yeah. And can you speak to those? I don't know I know you probably have a lot of science backing this, but in your world, IVF is really a more successful route to go versus IUI?
Well, it comes down to very basic biology. You know, if you look at the success rate, and again, success being defined as a healthy live birth.
Uh-huh.
If you look at a woman in her mid-20s trying to get pregnant over 1 month with a very fertile partner, okay,
Mm-hmm.
that woman has roughly about a 22 to 24% chance of getting pregnant over that 1 month.
Very little.
That's the chance of achieving a pregnancy.
Mm-hmm.
Once she's pregnant, she has about an 8 to 10% risk of miscarriage. And so the point is even amongst the most fertile women, not every month is going to be a good month.
Right.
That's just simply based on the fact that not every egg is a good egg. When there is a good egg, it might sometimes meet up with a bad sperm, or the timing might be off, or there could be a problem with implantation.
Mm-hmm.
And that's why we define fertility, challenges based on the number of months somebody's been trying to conceive.
Right.
And so when you consider someone that either has a lower window of time to keep trying,
Mm-hmm.
or they have a higher number of children that they want to achieve, you have to take all these considerations into account. With that in mind, one of the things I explain is that that's based on the 1 month pregnancy rate. When you talk about different treatment options, I always tell people, here's what happens if we control some of those natural variables.
Mm-hmm.
Here's what happens if we control more of those variables. And here's what you can expect if we control every variable that science allows us to. And so the bottom line is it's helping people make informed choices based on their understanding of what their variables are, what their odds are, and what interventions they could do to try to shift those odds more in their favor.
Yeah, I'm just kind of reflecting back on our last call, talking about the science, and I don't feel like I did your question justice, because I really value science, and I appreciate, without the science component of this, we would not have our daughter, and we learned early on in our story too, like we had male factor issues that were that would not allow us to really do IUI. And those tests, thank goodness for getting clarity early on. You and I agree, like you have to get good information at the beginning and to help you have your plan, right? To have a plan to go by. And so right away we knew IUI is not the route to go for us, and IVF was advised.
And part of how the science applies in your situation, the initial challenge was creating an embryo. And then somewhere along the way, the shift had to be towards, what do you need to do to create the healthiest environment for that embryo to thrive?
Exactly.
And again, that was controlling more variables, and you had the ability to pause between creating the embryo and then actually initiating the pregnancy.
Yeah, like a year pause. I mean,
I don't want to steal your thunder,
No, I mean, I appreciate, I'll share with everybody, Dr. Greene is writing the foreword of my book, and, so he's been reading my book right now, and I really kind of lay out our journey too, and it took us a while to get one healthy embryo. So people think my numbers looked good with my egg retrievals and things like that, but it's a combination. You want good sperm, good eggs, and our first egg retrieval did not result in any viable healthy embryos, and then went through another egg retrieval, got one. So I appreciate everything. You weren't my doctor at the beginning, but later on, everybody was doing everything they could to maximize our chance of this working out and optimizing my uterine environment to have a baby.
Yeah, and that's the point, and that's what I meant, what I referred to a few moments ago, that even as encouraging as the science is, and we're extremely competitive, we compete with each other within the practice, and then we always look at how we measure up to everyone else. But rather than looking back, we're always looking at how much better can we still become.
Yeah.
And that's how we keep pushing the science to the next level. But at the same time, I always remind myself, not everybody wants that level of control. Some people only want to control a few variables and roll the dice and see how they turn up.
Mm-hmm.
And whenever they do that, I try to, politely put my seatbelt on and say, this isn't my journey. I'm just
Yeah.
the chauffeur here. I'm going to get them there safely and the path that they've chosen.
No, I mean, gosh, we went through, we would go through anything that you advised us to do as far as a test that you recommended, or, if there was the scar tissue from the polyp surgery, take that out. Oh, you have fibroids now, take those out. I mean, you have to optimize the environment. And another thing, which I think will be another talk, but a lot of people have reached out and wanting to know about intralipid infusions. That's a whole nother topic, but I did 2 of those through you. Yep. That you recommended. And it's so funny. I like to laugh because I never thought I would pay to have fat injected into me. I'm like, I'm paying to get hooked up to an IV to hook that. And, there's research backing it that says, no, it can really help the embryo stick for implantation. And do you have any comments on that?
Oh, I have a lot, but you're right. Yeah. That's definitely something we should go into on a different day, because to be honest with you, it's something that I've helped develop over the years, on the journey that I've been. It started immediately with my transition after I left the group I was referring to. It's when I first became aware of it. And it's honestly technology I brought to the group that I'm part of now. And we have even more data now on it. And so I'm always happy to share the science with people, because one of the things that I always try to do is to earn people's trust and confidence. I don't want to tell anyone, do this, I know what's best for you.
Yeah.
I say, here's what's available, and here's the data that I think supports why you should consider it. But then more importantly is, after I've helped educate, which is, I think, one of the most important roles that I fulfill, then I need to sit back and defer to what that person's preference is and not push any harder, because the reality is a lot of people can get pregnant with less than I think might be helpful. And that's why I don't use words like what's necessary,
Yeah. Giving people options, guiding them to make the best choice, but advising them based on science, which is, you're really good at that.
Well, and it all comes back to part of what we started out talking about. This is National Fertility, Awareness Week, and that's why we're wearing orange, and it's all about empowerment. That's why we helped, advocate to get the Family Building Act passed here in Colorado, so that more people have insurance coverage for these options. So trying to take some of the financial pressures away to make it more of an intellectual discussion of, do you want to do this or do you not want to do that, instead of, can you afford this, which is an unfortunate reality that we just become the 18th state to pass this type of legislation, which means that the vast majority of the country still isn't going to have fertility treatment, at least all the fertility treatment options, as readily available as they are.
It's wonderful to hear you too, coming from a clinic, that you're in favor of this bill, because I think some other clinics may not, if they think, oh, it's going to take business away, or because it's all private, pretty much pay right now unless you do have some insurance coverage. So I'm glad to hear that you're in support of the law.
Well, it's not just me, it's my partners too. We really believe in what we do, and we want this to be available to people. We don't view it as a business, first. We're healthcare providers. Yeah, we do need to pay the bills.
Right.
And it is expensive technology, so we need to make enough to be able to grow and adapt. But we're healthcare providers first. If we wanted to go into business, we'd probably be bankers.
Oh my gosh. Well, I'm just thinking, gosh, just the science, yes, just the miracle of having that little embryo frozen for a year, and your embryology team, and they're the first babysitters, right? And just putting all of our trust in.
I always tell people I'm much better with embryo sitting than I am babysitting.
That's awesome. But it's just it's a miracle. Like, I truly am so grateful for the science that brought us our daughter. There's a combination of a lot of things that went into it, and without your expertise, we wouldn't have our daughter. So grateful. And
like I say, I remind myself every day, it's truly an honor to be able to do what we do and to be brought into anybody's confidence to, that they're willing to let us help them achieve their goals. So thank you as well.
Thank you. Oh my gosh. Well, I hope to meet your embryo one day. You've met my
She's fantastic. She really is.
Aw, well, I hope this was valuable for everyone listening and just hearing personal experience from Dr. Greene and his fertility story. Thank you for being so open with us.
Oh, absolutely.
And if you have any questions, need support, reach out to me, Lisa at IVFmanifestingamiracle.com. And Dr. Greene can be found at enhancingfertility.com. He actually just came out with a new blog today, which you might want to check out. And do you want to share what that topic is about?
Oh, basically, it's, today's the 50th anniversary of Earth Day. And so I basically shared some of the data on how having cleaner air, which we're all experiencing now for unfortunate reasons, but we're all benefiting from cleaner air. And I wanted all the people that have agreed to take a pause in their fertility treatment to understand how this pause actually might help them on their journey.
Yeah, with egg quality and sperm quality. So there's a lot of research that you share. And thank you for doing that. All right. Appreciate it. Happy National Fertility Awareness Week.
Stay happy.
Thank you. Bye.